Hey everybody, it's Dr. Yola. For this video, what I wanted to make sure that we did was address the myths about COVID-19 as opposed to providing an update. I think it's very, very important that we address the misinformation pushed out by social media and mainstream media regarding the virus. Now, clearly, the situation changes day by day, sometimes even hour by hour, but there are certain things that are being pushed out that are just absolutely false, and we're going to address those. The first is in the way of how the virus is transmitted. The second is in who's affected. The third is in how it's prevented. The fourth in how it's tested. The fifth is in how it's treated. And the sixth is in terms of how expansive the virus is in terms of the number of people who will be affected. In terms of transmission, one of the concerns that I see out on social media is products coming from China, whether they're products already in our grocery stores and retail establishments or products that are being ordered from China. What we do know now, based on recent studies, is that the virus can live on cardboard for at least 24 hours and on steel or plastic for up to 3 to 4 days. Now, you're clearly at risk if you have a product directly coming from China within that period of time, except viruses do not like changes in environment. So even if a product comes from China within a 3 to 4 day period of time, viruses become destabilized when you change their environment. Going from China clear across the ocean to get to the United States, the environment changes. The likelihood of a virus surviving that is very, very, very low. Now, let's talk about who's getting the virus. There are social media pushes that say that children aren't at risk and that African Americans or people of African descent aren't at risk. What we do know, looking at studies from Wuhan, China, is that 2% of children, or 2% of those who were positive COVID patients, were children. Of those 2% of children who were COVID-19 positive, 2% required medical care and 0.2% required intensive care. So clearly, children were affected in Wuhan. We won't know the total impact that COVID-19 has on our children until we start to closely look at those numbers. But as of today's date, March 13th, we have not lost a pediatric patient to COVID-19. Let's talk about African Americans or people of African descent. There has been a lot of noise in social media about people of African descent not being at risk, that there's some experiment that Chinese doctors did to determine that African or people of African descent are not at risk, and that's absolutely false. I live in a predominantly African American community, and several of the individuals who tested positive for COVID-19 were of African American descent. So clearly, everyone is at risk. Some of us are at higher risk than others, particularly our seniors, those with chronic diseases, and those who are immunocompromised. But everyone is at risk for getting the infection. Let's talk about prevention. There are two myths that are going around in terms of prevention. The one is that a Japanese doctor is sending out a notice that if we drink water every 15 minutes, somehow that's going to protect us from the COVID-19 infection. And I can say without a shadow of a doubt, that's absolutely false. Your digestive system and your respiratory system are completely separate in the body. When you drink water, it goes from your mouth, down your esophagus, into your stomach. When you transmit the COVID-19 virus from either your nose or your mouth in terms of respiratory droplets, it goes through your nose or your mouth, down your nasopharynx, which is the back of your throat, down your trachea, into your bronchioles, then into your bronchi, and then it can affect your lungs. Two completely systems. Drinking water does not enter into your respiratory system unless, of course, you choke. Other than that, water is only going to maintain good hydration and good health. Let's talk about hand sanitizers. There are a lot of social media pushes about creating your own hand sanitizer at home, using Tito's vodka to mix with aloe vera gel. Although I don't drink vodka, what I do know is that you need at least 60% alcohol in order to make an effective hand sanitizer. And from what I've read, Tito's vodka is only 40% alcohol, as are most, if not all, vodkas. I can't tell you which alcohols have 60% or higher, as I don't imbibe often. I'm sure you can look that up. But if you're going to make your own hand sanitizer, make sure you're using at least 60% alcohol. Let's talk about testing for COVID-19. There are stories out that if you hold your breath for an extended period of time, that somehow lets you know whether or not you truly have the virus. What I will tell you is that that is also incorrect. If you have cough and fever, it means, particularly in this day and time, that you call your healthcare professional to assess your risk. By the time you have shortness of breath and the inability to hold your breath, you need to actually be seen by a healthcare professional. The ability or inability to hold your breath is not indicative of whether or not you have the infection. The only way that we can confirm whether or not you have the infection is by doing a nasopharyngeal swab and sending that swab off for testing. So let's just be clear, holding your breath or your inability to hold your breath does not tell you one way or another whether or not you have the infection. Let's talk about treatment. One of the things that people are talking about are all these varieties of treatment. Some people will use this as an opportunity to swindle people out of money. They will see it as an opportunity to push out all kinds of products and convince you that this is the cure for COVID-19. What I can tell you today is that there are no cures. We as healthcare professionals are still trying to figure it out. We're trialing antivirals. In China, they're trialing high-dose IV vitamin C. There is no clear treatment other than supportive care. All we can do is help people in terms of their symptoms. There are pastors selling silver tincture, and you name it, people are creating the products. It doesn't mean that fortifying your nutrition, like making sure that you take vitamin C so that your immune system is strengthened to protect yourself. Absolutely. Making sure that you're eating healthy. Absolutely. But doing some of the things that I see pushed out in social media is just misinforming people. There is no cure as of yet. Now, clearly this can change as we take care of more patients. Even within the medical space, we're having conversations about what's most effective, but we're responsible enough not to push that out until it's completely vetted and shown to be effective. Let's talk also about the extent of the epidemic. There are reports being pushed out, and one of them came out of my alma mater, Johns Hopkins University, that 65 million people will be infected with COVID-19. Let me let you know that that was an experiment done by my alma mater to determine, in worst case scenario, what would happen if our public health infrastructure, our government, and our health system was not in place in order to prevent spread and treat patients. It wasn't that it was an anticipated or an estimate of what would happen, but in worst case scenario, when we aren't able to do the things that we are clearly doing now, how far spread would the virus get here in the United States? Clearly, we're taking measures to protect everyone. It's the reason why schools are being shut down for at least a couple of weeks. Sporting events are being canceled. It is for our prevention. It is not an overreaction. We know that in epidemiology, when we can control the spread, we decrease the peak of infections, the higher the number of infections, when we follow the recommendations of our public health professionals. So what I ask you to do is to please vet the stories that you're getting ready to share before you share them. There's a website, www.snopes.com, that you can use to vet the story. They will give you, one, whether or not it's true, and two, they'll give you the story behind whatever is being pushed out. Not only do I use that, but I go to trusted sources. I go to WHO as one of my trusted sources. I go to my alma mater, Bloomberg School of Public Health at Johns Hopkins. I rely on my local health department in order to make sure that I am providing you with up-to-date, accurate information, and I would ask you to do the same. Because really, this is part of being our brothers and our sisters' keeper. Not passing out information that's going to cause fear and hysteria. And just as a side note, in terms of being brothers and sisters keeper, a student of mine shared a story yesterday. It was a heartbreaking story. She stepped outside of her building, recognized that there was a person on the ground, and likely who had been walked over for who knows how long, and he was dead. It was people walking past him, not taking the time to check in on him to determine whether or not he needed assistance. And given this time where our seniors are in their homes and isolated, they may not have resources. There are children that are going to be home for 2 weeks. And a good number of these children, the only time they have access to food is at school. They may go hungry. This is the time for us to be our brothers. I get emotional just even thinking about it. This is the time for us to be our brothers and our sisters keepers, making sure that we're checking in on our neighbors, our friends, our family. Each of us knows someone who needs some support, particularly during this time. So I implore you to, one, vet your information, and two, to just love on each other, take care of each other, and protect each other. Dr. Yola out.